public health imperative is there. Thank you.
Preet Kaur Gill.
Thank you, Sir Christopher, and it's a pleasure to serve under your chairship. Can I thank the honourable members for Glasgow Central and Stockport for securing this debate, and my honourable friend for Glasgow Central sharing her personal experiences. I know that they are both great champions for improving health outcomes for all, and I'm grateful to them for bringing this debate to discuss a neglected but major killer. I also want to thank my honourable friend for the member for Washington and Sunderland West, sharing shocking figures of liver disease in her constituency. And as the honourable member for Stockport highlighted, new data released this month shows that we are facing the worst mortality and hospital admission rates for liver disease in a generation. Over 17,000 people die of liver disease and liver cancer each year, almost half among people of working age, that's age 15 to 64, at a huge cost to the NHS and the economy. And we've heard from members that 90% of liver disease is preventable, and if diagnosed at an early stage, damage can often be reversed and the liver can fully recover. It is an avoidable epidemic that is being driven by obesity, alcohol and viral hepatitis. And all of these issues increase in prevalence in the most deprived communities and drive health inequalities that we are here debating today. So this debate is timely because it comes in a week that we have received the sobering news that annual figures for alcohol-specific deaths have passed 10,000 for the first time ever. 76% of those were from liver disease, including liver cancer, but it is the third year in a row that deaths have risen across the United Kingdom, breaking previous records each time. And the rise was not inevitable, and it cannot be explained away as the product of the pandemic. It is a policy failure, and ministers today must answer for it. Outcomes for many types of cancer have seen huge improvements over recent decades, but as we've heard today, deaths from liver cancer in the United Kingdom have increased by 40% in the last decade alone. And it is the fastest rising cause of cancer death in the United Kingdom. And again, we've heard today, it's got a shockingly poor 5-year survival rate of just 13%. And public awareness remains very low with liver cancer patients, overwhelmingly diagnosed at a late stage. To her credit, the Honourable Member for Faversham and Mid-Kent recognised this when she committed in a letter to the Chief Executive of the British Liver Trust that the government would make fibroscans available for use at 100 community diagnostic centres by March 2025. Now, I have used one of these fibroscans and they are a fantastic piece of kit which can tell you whether you have liver damage or early signs of liver disease. So why is it that in answer to my parliamentary question that I received in February, the Minister said that the government has plans for fibroscans not at 100 diagnostic centres, but only 12 as at the end of March? What about the other 88? It is all very well the NHS announcing funding for a new diagnostic pathway, but without the kit in local communities, how will that actually work? How and where will patients access scans and tests? Will they be available in the most deprived communities, where outcomes are far worse? And what about in GP practices or in pharmacies? Perhaps the Minister could take up Labour's fully costed plan for a Fit for the Future fund to double the number of MRI and CT scanners so that we can catch illness earlier, treat it faster before it's too late. To tackle health inequalities, we have got to get serious about public health and a prevention-first approach. Under this government, for the first time in a century, life expectancy has dropped in England and a growing number of people live more and more of their life in ill health. And while this decline affects us all, again, we've heard this from many members, it is not spread equally across the country. Over a third of all premature deaths were reported in the north of England in 2022. And in my city of Birmingham, life expectancy has dropped by nearly 2 years in just 3 years. And in Blackpool, you are 3 times more likely to die from chronic liver disease compared to the rest of England. And in parts of that town, life expectancy for men is just 2 years older than the retirement age. But what do you expect when the Prime Minister boasted about changing funding formulas to take money away from deprived urban areas? So, Christopher, as I mentioned earlier, alcohol consumption alone caused over 7,500 untimely deaths from liver disease in 2022, and those mortality figures have risen 3 years in a row. Yet, faced with this, the government has taken the decision to dismantle the central public health function. And as far as I can tell from the non-answer I received to written questions on this, they have abolished the Department of Health and Social Care's alcohol policy team. So can the Minister confirm, if this is the case, that there are no dedicated alcohol specialists in OHID and that team has now been redeployed? Should we take this as an indication of how much ministers care about this issue? And does that actually help us understand why there was no real terms increase to the public health grant in the spending review in March, even as alcohol treatment services have been hollowed over the last 14 years? So, Christopher, it does not bode well for the prevention strategy that the Health Secretary has promised before the summer recess. Hopefully, it doesn't go the same way as the major condition strategy and the health disparities white paper before that. But I am encouraged to hear that measures to tackle the obesity epidemic should feature in that, if not alcohol. Fatty liver disease and excess weight significantly increase the risk of premature death due to not just liver cancer, but colon, breast, prostate, lung, pancreatic cancers, and not to mention heart disease. When 1 in 6 children are obese by the time they finish primary school and 1 in 4 children with obesity are estimated to have fatty liver disease, this government has sat on a ticking time bomb for the last 14 years without taking action. Labour is committed to ensure that all children get a healthy start to life, with free primary school breakfast clubs serving healthy food, an active and balanced curriculum, and a pre-watershed ban on advertising junk food. So can the Minister confirm that concrete prevention policies to tackle the obesity epidemic will be included in the prevention strategy? And will she finally publish the consultation on the junk food ban and get on with legislating it? When mortality rates from liver disease are now 4 times higher in our most deprived communities compared to our most affluent, it makes a mockery of the government's rhetoric on tackling health inequalities and levelling up. To build an NHS fit for the future, Labour is committed to hitting all NHS cancer waiting time and early diagnostic targets within 5 years, and we will drive a prevention revolution with measures to tackle alcohol harms and the obesity epidemic, banning junk food ads to children, boosting capacity in local public health teams, and recruiting thousands of mental health staff to give more people access to treatment before they reach crisis. And as part of our 10-year health mission, we will improve healthy life expectancy for all and halve the gap in healthy life expectancy between different regions of England. Thank you.
Andrew Leadsom.